My name is Doreen Garland, and welcome to everybody to the Human Services and Community Initiatives Committee meeting. This meeting is now called to order. Please state your name when you are making comments or asking questions during this meeting, and we will begin the meeting with a roll call of all of our members.
Thank you very much, Madam Chair, members of the committee. When I call your name, please unmute and let us know your affiliation. Councilmember Campbell. Councilmember Klein.
City of Surprise.
Thank you. Councilmember Conde.
Here, City of Avondale.
Thank you. Councilmember Dorsey. Councilmember Duff.
Here, City of Mesa.
Thank you. Councilmember Ellis.
City of Chandler.
Thank you. Councilmember Galindo Elvera.
Here, City of Phoenix.
Thank you. Vice Mayor Garland.
Here, City of Tempe.
Thank you. Councilmember Graham. Councilmember Guy. Councilmember Murillo as proxy for Councilmember Patina.
Here with City of Peoria.
Thank you. And Councilmember Tilke. Madam Chair, we have quorum.
All right, thank you very much. Our next item is agenda item is number 2. It's a MAG provides the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda. Informational items are items on the agenda for discussion and not for action. Members of the public are invited to submit written comments via the MAG website, and any comments received 2 hours prior to the meeting have been shared with the committee members in advance of the meeting for consideration and will be included in the formal meeting minutes. Staff, do we have we received any online written comments for the call to the audience?
Madam Chair, we did receive one comment, and that was submitted online. We have shared that with all of the community members prior to this meeting.
All right, thank you very much. So we will now proceed on to item number 3, which is informational items, and there are no informational items for this meeting. So the next agenda item is number 4, which is approval of the consent agenda. Item 4A is on the consent agenda. Does any member of the committee have questions or request a presentation on this item? All right, anybody online? Nope. All right, hearing none. Prior to the approval of the consent agenda, there's an opportunity for members of the public to comment on any item on the consent agenda. Anybody in line to comment? No, we do not. Staff, have we received any online written comments for the consent agenda?
Madam Chair, we have not.
All right, thank you. So then do I have a motion to approve our consent agenda, consent item number 4A?
I so move.
All right, do we have a second?
Second, Ellie Klein.
Thank you very much. We will have those participating in the meeting now take a part in the voice vote by turning on their cameras and unmuting their audio. We need to see the faces of everyone to participate in the voice vote. For those who cannot or do not want to turn on their cameras, staff will conduct a roll call vote. The staff will only call on those virtual participants who did not turn on their camera. Members, please leave your camera on until after the roll call vote so that staff can count the people's names whose cameras are not on. Can I have a voice vote, please? All those in favor say aye.
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 All those opposed, same sign. All right. Then we have a, we pass that. Do you need? No. Okay. All right. Thank you so much, everybody. We've passed that unanimously. We will move on to item number 5. It's a Maricopa County Public Health Assessment results. It is helpful to learn about the needs of the communities we serve as we recommend the regional activities. The Maricopa County Public Health Department is here to share the results of those coordinated community health needs assessment. And we have online Tiffany, Jessica, and Annie, and they are going to join us to present the results of the committee's information. Do we have them online? Okay. And it looks like we have Wally in attendance also now for the meeting. And Councilmember Dorsey, welcome.
Thank you.
All right, presentation is and time is for you.
All right, thank you so much. Good morning, everyone. My name is Annie Daviud. I'm actually presenting here solo this morning, but my colleagues Tiffany and Jessica were able to present at the September meeting, which I apologize. That is the date that we have there, but obviously today is December 5th. So we are excited to come and have some time with you to share the results of our community health needs assessment, a countywide needs assessment of really health and well-being of Maricopa County residents. So we can head to the next slide. So what we're going to be looking at today is an overview of the community health needs assessment, get into some survey results, data topics of interest that we've received from that we know that MAG is focused on, as well as next steps, and then if time allows, opportunities for some questions and discussion. If at any point you do have questions, feel free to, either you're welcome to come off mute, or if you want to write them down for the end of the presentation, we can definitely handle it flexibly today. So introducing our team, we have myself. I am the Community Health Assessment and Impact Supervisor at Maricopa County Public Health. I work with a fabulous team. Tiffany Tu and Pearl Gore are both Community Health Impact Specialists. They do a lot of work with our hospital and healthcare coalition partners. That's a coalition called Synapse, which I'll get into in just a bit. Jessica Francis is our Community Health Assessment Coordinator. This is a new position that we were really justified based on just the amount of reach that we had with this last assessment. Hamza Rafiq is our Community Health Epidemiologist, so pulls a lot of the population data and analyzes results that we get from our survey collection. And then Lihan Iyasu is our Communications Coordinator, making sure that all the products we put out are looking good, branded well, etc. Next slide. So just a little background, Maricopa County Public Health. Our vision is to create a healthy, thriving Maricopa County for all, with core values of excellence, collaboration, resourcefulness, accountability and integrity, growth mindset, and inclusiveness. So one of the main ways that, one of the many ways that we really implement this vision is through understanding what residents are experiencing and letting those voices inform the work we do, the data we put out, recommendations that we make. So that's why we conduct these needs assessments, and it's amazing to have opportunities such as this one to put those results out into the community. Next slide, please. So as we do an overview of the Community Health Needs Assessment, or CHNA, or I might say CHA, that's easier. Those are all kind of referring to the same thing. Next slide, we have kind of a diagram of the infrastructure that we use. So as the county, we are the convening agency that brings together a couple different coalitions. I hinted at our hospital and healthcare partnership, Synapse. Synapse has been around as a coalition for the last 10 years. With the advent of the Affordable Care Act, requiring nonprofit hospitals to do a needs assessment every 3 years to retain their tax-exempt status, several of our major hospital systems came to the county 10 years ago and said, how do we work together to collect data that can inform the services we're providing and what we're seeing in the community? So currently we have 5 hospital systems and 5 federally qualified health centers and 1 health foundation that are all a part of the Synapse coalition. So what's really exciting is that we work together to collect a much larger amount of data than we would collect had each organization been doing their own survey of their patients or a few hundred community members. So our assessment capacity is so much higher, and it means that a lot of our major healthcare systems are looking at the same community data to make decisions. So that promotes alignment and collaboration and some of those system-wide changes, which is super exciting. On the other side, we have our Health Improvement Partnership of Maricopa County, which we call the HIPMC. That is a coalition driven by community partners. There is a steering committee of community partners that are with organizations from across the county, across sectors. The focus of that is to ensure that we are having just voices from across the county represented in decision-making. And this group takes the results of the needs assessment and works on creating a health improvement plan, or we call it a CHIP. Lots of acronyms, I know. And so what we do is really pulling both these coalitions together is what makes up the Maricopa Health Matters. That's kind of our collective movement. And we're actually working to kind of even further define and highlight that collective as opposed to each of just the individual coalitions. So everything that I'm sharing today, you'll be able to find in more detail at maricopahealthmatters.org. That's where we publish all of our reports and webinars and presentations. So you'll be hearing that one quite a bit as we move forward. So next slide. As mentioned, the CHNA is this comprehensive data collection of community to identify strengths, needs, and health priorities. So for public health departments, as a accredited health department, we are required to conduct this needs assessment every few years, once again, to ensure that we're aligning our work and our focus with needs identified by the community. And this also establishes priorities for that community health improvement plan. And then for healthcare, as I mentioned, it's a requirement of nonprofit hospitals to kind of look beyond what is their daily services and scope of work to better understand kind of how can they be responsive to the areas they serve. We've had several of our hospital leaders who are part of the coalition have given stories of prior to this collaborative work. You know, of course, they're focused on what their treatment services are and specialization. But as a result of looking a little bit broader, that's really helped to connect more with other either nonprofits or community-based organizations to better link out care for those needs that are identified. And then the healthcare facilities use this information to develop an implementation strategy plan. Next slide. So when we follow the MAP 2.0 process, that is a nationally developed methodology for us to kind of go through this really complicated process of understanding what, you know, trying to get a lot of voices from the community, understand what people are going through. There's a couple main pieces of data that we collect. One is this community survey. That's what I'm going to be highlighting quite a bit today. There's also focus groups and key informant interviews. We have tons of reports of all of this on our website. But as mentioned, if you maybe can hit down the next two slides, I have it highlighted, I think. The community survey and the focus groups are really what we're focusing on. So with the survey, we collected data in spring of 2023. We did a lot of events that were in person to collect data, but also virtual recruitment, sending out information online. We set and monitored recruitment goals for representative participation. I'll get into that in a little bit of kind of what previous years looked like compared to this past cycle. And then we made sure the survey tool was designed with more accessible options, such as large font print. We had the survey available in 13 different languages. We even had one of our partners who works for blind and visually impaired organizing. They put the survey into Braille, so just a lot more accessible than it had been in previous years. Focus groups, we also conducted in person and virtually, recruited focus population participants to make sure we're really hearing from folks that tend to be most impacted by health concerns and health issues, social determinants of health. They're connected in English and Spanish by a county vendor. And then key informant interviews really were focused on leaders in the community across different sectors to understand what are some structural concerns, issues, and strengths that we have. And that was also conducted by a county vendor. So heading to the next slide. Fabulous. As we get to kind of the keys to success, I realize I buried the lead, which is this cycle we conducted over 18,000 surveys. This is by far the most amount of data that we've collected from needs assessments in the past. And these surveys better reflected diversity of geography, demographics, and other kind of special focus population characteristics than we've had in the past. So we had clearly defined participation goals and routine monitoring every week. We were pulling the surveys that were collected and saying, okay, where are we hitting some of those goals and where do we need to focus our efforts? We engaged local community organizations to collect data. by partnering with 23 different community organizations who are much better embedded in these communities. We also work to mobilize public health staff, volunteers, and students to collect data through events and tabling. I believe we attended over 130 events in the community, had different giveaways, just to kind of, make sure that people who didn't see our post on Facebook or through a community organization, just so that we were there. We partnered a lot with our cities and towns to attend events and get permission to come to different local fairs, different meetings, those kind of things. And so we are super grateful for all of our city and town advocates working to collect this data as well. And we had a comprehensive communication plan with internal group meetings, online toolkits that could be sent out, as well as participants could sign up for updates. So that was something new this year. If you took the survey, you had the opportunity to separately, not connected to your data, separately sign up for an email listserv and then get updates when different deliverables were published. We know that in the history of research, especially from public health organizations, it's easy to take data from community, and it's super important and a big value of ours to be giving that back so folks can really see what their efforts and their, that 15 minutes or 20 minutes they spent, what that led to.
Annie, I have a question.
Yes.
When you were collecting the data and you were saying you collected data from 18,000 surveys, which I think is incredible. Do you do a mapping of the county to make sure that we are covering every little nook and cranny or as many nook and crannies of our county that we can?
Yes, so we have a couple of different strategies for that. One is that we do have the county divided up into 5 different public health regions. Let me see if any of my slides. Okay, yes. Actually, if we jump down a couple to, I believe it's slide 17. Sorry, I have a lot of little boxes that show up. Oh, right, the one right before. Perfect. Sorry, it's a little bit small, but we divide the county up into 5 different regions. These regions were determined based on our needs assessment in 2019 and looking at where kind of how to split up some of our different communities in ways that are maybe a little bit more similar demographically and also just make sense regionally. So one of the things we did is we set targets for each of these regions that were based on population. So of course, our central Phoenix region has the highest population. And so we expected to collect more surveys there. Another thing that we did was we set targets for each of our cities and towns. So you will, if you go to the website, we have profiles of data that are available for 15 of our cities and towns. We don't have all of them available because the requirement was to collect at least 250 surveys from a city or town to publish like a further analysis of that data. And so we had our public health liaisons. We have liaisons for each of these regions. They were reaching out very frequently to, whether that was City of Tempe or Town of Gilbert to say, hey, we're 2 months into data collection. You've collected 200 surveys. If we get 50 more, you can have that profile. So I'm not sure if anyone on this call was part of some of those discussions, but that was kind of the regional approach and then the city and town approach. We didn't go quite as deep as like zip code level, just because that was a little bit more difficult to track, but we did do those efforts to at least city and town and then broader regional level.
Okay, I appreciate it. Thank you. That answered my question.
Great. Awesome. I love that. Thank you so much. Fabulous. Okay, next one. So this is an example. This was a screenshot from our website in April of last year of what information we were showing to the public about how close we were. So we wanted to collect 15,000 surveys. Obviously, we exceeded that. But our goal was to collect a number of surveys that we had in the past, but just more representative. So we showed by race, ethnicity, by region, and by population characteristics, how close we were to those goals we had set. We set those goals based on the minimum numbers that we would need to be able to publish data, but then also scaled it up based on population. So what's neat is that even for some of these, we'd never ultimately hit our goal, for example, for Native Hawaiian Pacific Islander. However, we set such ambitious goals that the participation that we received did provide enough data for us to publish that demographics worth of responses to surveys. So there's ways that we will probably be tailoring these goals in the future. Again, we started out really ambitiously, and I think that helped to meet those minimum numbers. But this is just an example. We wanted to have transparency with the public of about how close we were getting. Any questions on, let me know if there's any more questions on kind of like that recruitment or how we set these goals.
I don't see any questions, Amy. Thank you. Annie.
All right, so the next slide shows a little bit more of that growth of responses over the years. So we did our first needs assessment in 2012 and collected almost 1,000 surveys. And that number increased year to year as we included kind of more features. So the first couple years we had English and Spanish surveys and a paper format. We introduced a virtual format in 2019, as well as some mini grants for outreach. So those grants went to the community partners for them to collect data in their communities, as well as that regional approach. So making sure that we're getting results from across the entire county. 2021 was height of COVID, so we did not do paper surveys. That was virtual only, but that was the first time we added languages beyond English and Spanish. Then 2023 was this first time we did paper and virtual, 13 different languages, mini grants, regional approach, etc. We ended up we thought reintroducing paper would probably be useful for some of our different, communities. We found of the 18,000 surveys we got back, 5,000 were paper. And we noticed that like events or if we tabled at clinics, those kind of things, sometimes people just prefer to be able to see it all, mark off their answers, even though we had it available on iPads and QR codes and take it on your own phone. So that was a really interesting learning experience that we has such a high percentage of our results in paper format. And that's definitely something that we do intend to continue into our next cycles as well, even though we want to save the trees, but we know that this is super valuable data collection. So making it more accessible is really useful. All right, next slide. Let's get into results. So first I'm going to talk through some demographics. When we looked at our 2021 needs assessment, that was how we determined what we needed to do better this cycle. So in 2021, we saw underrepresentation from African American, Black individuals, Hispanic, Latinx, and males. So you see here, compared to the population of Maricopa County, 5% African American Black, we had only 4% of our survey respondents identify as African American Black. And then for Hispanic Latinx, we saw 19% of respondents identify as Hispanic Latinx, although 30% of the population identified that way. So that underrepresentation there, and overrepresentation from our Caucasian and white participants. We also had compared to, approximately the half and half kind of sex assigned at birth. I will say that we didn't capture as detailed of gender demographics in 2021, but we did still see a very strong underrepresentation of men who took the survey. So we looked at this data, we said, how do we do better? How do we make sure that we're getting more data from across populations across the board? So if we head to the next slide. What we are, a few things that we're excited about is that we increased and we expanded the ways that we collected, for example, gender data. So instead of just having man, woman, other, we included cisgender man and woman, transgender man and woman, non-binary gender queer, and then there was a write-in option as well. So we see here that we were able to capture this data on some of our populations that we typically don't have much data on at all. So we were really excited to see that, especially if you head to the next slide. Yes, in our, one back up, where it has a little box. Yes, so our transgender man, woman, and genderqueer, that was something we weren't able to capture in depth previously. And we know that based on like census data and stuff, this data is it can be difficult to have at a population level. So we're really excited for that. Next slide. When we look at our race ethnicity, if you hit down a few more slides, it'll show up a few more boxes. Fabulous. So the light blue is the population based on the census. The dark blue is our respondents based on the survey. So we had, well, 2% of the population of Maricopa County identifies as American Indian or Alaska Native. 6% of our total respondents identified as American Indian or Alaska Native. So we really exceeded kind of those goals to get representation and have been able to publish quite a bit more data from each of these groups. Same with Asian, Black or African American. Again, previously we were underrepresented in this group, and now we've been had even a greater amount of participants than necessarily expected. What I will say about Hispanic or Latino is that we did change the way that we ask that question. Typically on census, you have race and ethnicity separate, but through a lot of community piloting, we decided to include this all Hispanic Latino as its own category, based on the feedback of many people for whom they say I identify as Hispanic or Latino. I don't identify necessarily as other Hispanic Latino, but all that to say that makes the numbers look a little bit lower as well. And you'll see that actually population-wise, this adds up to more than 100 because the census is based on that two-part question. So just kind of explaining why there's like a little bit of disparities, and it makes when we update our methods for capturing more inclusive data, it can be difficult to track that then with some of our more longer term population statistics. All right, and then for 2 or more races, we also, one of the things that we've run into in the past is that if folks select multiple races, sometimes just for the sake of analysis, it is a little bit easier to collapse, but also a little bit more representative to collapse folks into maybe one category. But in this survey, we asked folks, if you identify as multiracial, is there one that you identify with the most? And we gave the option of, I identify as multiracial. So we didn't require people to focus just on one, but we put that power back in the hands of our participants instead of having that be like a back-end analysis decision. So just some of those ways that we're trying to think about bringing in a more equitable approach this cycle. For age, we had representation for 65 plus was really on track with our population. The survey was only open to age 12 and up, so of course, highly underrepresented our minor population. And then we still had quite a gap with our male respondents, but it's something we're going to keep working on and have some ideas about how we can hopefully get more of that engagement in the future. All right, next slide. So you've seen this one already, how we tracked regionally where we were looking at these responses from. We had almost 1,000 veterans take the survey, almost 1,400 people with disabilities take the survey, over 2,000 folks who identify as LGBTQIA+, and nearly 1,700 folks who are refugee, immigrant, and migrant. So each of these different categories, aside from veterans, we have a specific 3-page profile available online. Same with each of the regions and same with those cities that reached the 250 respondent mark. So that is something that I'm hoping we really tried to make it just eye-catchy and straightforward, and I'm hoping that will be a good resource for you all as you use this data. All right, let's get into some actual results. So kind of moving from methodology and participation to results. Just double checking any questions kind of in that setting the stage period of kind of who's included in the results.
No, I see no questions.
Okay. So one of the questions that we really guides our work in priorities and focus areas is this one. We asked which health issues have the most impact on you and or the people you live with or care for. Basically 4 out of 10 people who took the survey said anxiety, 34% said depression, and then followed by high blood pressure, chronic pain, and diabetes. In the past, we have seen mental health, substance use, and homelessness be some of our top issues. In this question, homelessness was not categorized as a specific health issue, but is categorized in our social determinants of health questions. So we will get there, but it's pretty astounding to see just these rates of 1 and 2 mental health issues. If you look at the data for your specific region or city and town, I will say most of them follow this pattern for the top 5 issues, but some of them are a little different. Some of our cities and towns have stroke as one of the top 5 health issues, but most all of them do have some degree of diabetes and mental health as those top identified ones.
Annie, this is Carlos Galindo Elvira, City of Phoenix. I got a
Yes.
question for you. The mental health aspect of all of this is pretty alarming in terms of the numbers.
Yeah.
How to share this information or inform local foundations or corporations that have foundations, because many of these issues are bound together in terms of integrated care. So how could we, for example, give this information to the Arizona Community Foundation to help inform the way they set up their guidelines for what they'll fund that would match the survey to assist local individuals or throughout the state?
I love this question. It's so actionable. A few different resources. One is I was mentioning the profiles that we have online, and we can, I'm trying to think. So if you go to maricopahealthmatters.org, you look at data and you scroll down, I can also send some direct links of some of these items. This is actually a screenshot from that profile. So when you look at the front page, it says Maricopa County, 18,000 responses, boom. This is like the first thing you see. So it makes it really clear anxiety and depression are like the top 2 issues. What we can also do is, again, depending on kind of like the area of focus, for example, if it's like a regional focus or a special population focus, for example, if you want to present this data to folks who work with seniors, we have a 65+ profile. They're all set up exactly the same. And so you pretty immediately see, boom, mental health is like the top couple issues across the board. So I would say that if the communities or the organizations that you want to share resources with, if they want a 3-pager, they look really pretty, they'll print out nicely, I would say that is a great resource. And then we did just yesterday release our dashboard, which synthesizes all this data together, and it highlights our top 5 priority issues, which we went through a whole process with the community to decide on those. Mental health is the top one. And so if the folks that you're wanting to share it with are a little bit more interested in the details, you can also share that dashboard and specifically the link to the mental health page. And they'll be able to see data from survey, data from population, and quotes. That's a huge piece, is that we have a lot of quotes from community members about trying to get mental health care and not having an insurance coverage or not being able to get off a waiting list. So those are some data resources. And I think we'll get into, I'll get a little bit more into depth about pulling those together for mental health a little bit later on. And so even if it's, if there's a slide or two that adds that we focus on mental health, you're like, that tells the story. We are happy. All of this we want to share out. So is that helpful?
Yes, thank you for your comprehensive response.
Thank you so much for the question. All right. Next slide. So here we come to community assets. So we had a whole long list of different social determinant of health related community assets, and people could rate them as good, fair, poor, or NA, or not applicable. So the ones in orange are the most likely to be rated poor, green the most likely to be rated as good. Here we go with that. I mentioned homelessness has always come from the past. Access to affordable housing, top issue, rated poor across the board. Followed by access to quality public transportation, and then ability to communicate with local leadership and feel my voice is heard. So I know, as I'm guessing as members of MAG, this is one that, again, out of the probably 20 different community assets that we provided for people to rate, this coming up as a top 3 might be something that is of interest. The top best rated assets were access to parks and green spaces, opportunity to participate in religious, spiritual, or cultural events, and feeling safe in your home. And again, based on whatever jurisdiction you represent, it is quite likely that we have a profile for you, so you can take a look at where your city or town, how that matches to the county. Another thing that I wanted to mention too, and I'll come back to at the end, is that we did regional road shows of this data with our public health liaison, and those are all available online. So if you're, if you represent, like, say you're from, I live in Tempe, so I'm just going to say Tempe. So that would be the southeastern region. You can watch our 1-hour webinar. And what we do is we take the county data and we compare it. So we say, where did residents from Tempe say something different? Did residents from Chandler say something different? And that kind of dives into some of those differences. Okay, I think those are our 2 kind of just overall setting the stage. And then we're going to get into a few topics of interest that Amy had suggested that this group would like more information on. Yes.
Oh, sorry, Annie, to interrupt. This is Amy. Just want to let you know, we do have 3 presentations after this, and we're starting to run a little short on time. I'm wondering if we can, it's great information and we really appreciate it. I'm wondering if we can move through the rest of the slides maybe a little bit more quickly.
Yes. How many more minutes do I have? I will tailor it accordingly.
Can we do maybe 5 minutes or so more? Is that okay?
Absolutely. Yes. I get really excited about the data and
It's
slides, so.
I can see why. No, that's great. Thank you very much.
No problem. These slides will be available for you all too. So I'm thinking between the topics of mental health, substance use, housing, transportation, let's do mental health because we talked about it. And then there's more slides available for the other topics that you all can revisit. And I'm happy to, if you'd like to chat more with me, I'm happy to set up, additional connection. So for mental health, go to the next slide. Here's an example of how we pulled together different data sources. So we were looking at folks who said that anxiety and depression were top health issues, what populations were the most impacted? And we saw that respondents who identified as homeless or houseless, out of all the houseless or homeless individuals who took the survey, 55% said that anxiety was a top issue. And 52% said that depression was a top issue. For those who were identified as disabled, anxiety was a top issue, followed by depression. And then a quote from a participant: mental health services are nearly impossible to find or afford. The healthcare system is complicated, inefficient, unjust, inadequate, and an embarrassment compared to other developed countries. Patients have to become full-time secretaries for themselves to have a chance of navigating it, and also become a mature medical specialist to make treatment decisions. So I'm just that little snippet of pulling some of these sources together. Let's jump to, and I think we have one more slide on mental health. So we also asked, how would you rate your mental health, such as your mood and ability to handle stress? So 45% of people said very good, 43% said fair, and almost 10% said poor. Another quote: mental health issues are at an all-time high, and as someone who struggles with anxiety, depression, I've experienced it to be extremely hard to get proper help, find a therapist or psychiatrist, find affordable ones at that. I think this is a huge issue in all communities. We do have a slide on substance use and let's jump to housing. I think that's slide 26. So how did the following special populations rate access to affordable housing? So those who identified as housing homeless, 60% said access was poor. Those who identify as disabled, 50% said access was poor. So we really kind of see that intersection of some of these like disability and ability to find housing. This is a quote that is just talking about being in between, not making enough money to afford a standard, a certain quality of life, but also not qualifying for different benefits. And so that is something that you can look into a little bit more when you have access to the slides. Let's jump to transportation next, because I know that's a focus area, slide 34. Two more down, please. Thank you. So when rating access to quality transportation, those who identified as homeless, houseless, about 38% identified access as fair and 34% identified it as poor. Those who are disabled, we had almost 39% identified transportation as poor. To summarize this quote, we need to really invest in that public transportation, not only to improve air quality, but also to really kind of reduce accidents, and we need better opportunities for cyclists and pedestrians. Again, these are just little snapshots. We have way more in-depth data available on our dashboard, which again is just published. So I will close with sharing, if you can head to the next couple slides. So up next is that we are working on the community health improvement plan. So we've gone through a long process of looking at this data with our community coalitions and setting priorities. So we've set 5 top priorities. And those are the ones that we have subcommittees working on. Would love to invite anyone who is interested or has colleagues who would be interested in joining to those subcommittees. We're just trying to convene folks who work in these areas of mental health, housing, substance use, access to healthy foods, and access to healthcare. And then next slide, this is where you can go for all the exciting things I've mentioned. So if you scan this QR code or go to maricopahealthmatters.org and click on data, you'll find in-depth reports if you really like all the numbers. This community survey, this blue box, 80-page document of how everybody or of how different groups responded to survey questions. The CHNA dashboard, which is now live, has all the data really in context with like stories and population data as well. As I mentioned, we have webinars. We have a webinar on what is a needs assessment, what is a CHIP, and then the 5 different regions of data. And we have profiles. So again, your region or your city or town, or if there's a special population you work with, we have 3-pagers that are sliced and diced with data from each of those. And really, I think are probably going to be the best source of here's kind of the top data that you need to know and can share with your community. So with that, please, I'm sorry for the rush at the end, but please feel free to reach out with any questions, and our team would be happy to either present again or connect with you individually.
All right, Annie, thank you so much. Love the data, and thank you so much for sharing with us. Committee members, do we have any questions or input for Annie? No, we have.
Councilmember Ellis here with Chandler.
Yes.
Really great amount of data. What I really appreciate in this data, it didn't really just go surface wise, but it was deeply into understanding the correlation between spirit, soul, and body, looking at the person as a holistic way rather than putting them in compartments. Whether it was we went from looking at what the top priorities were all the way to the bottom of food insecurity. How does that relate it to their health and everything? And then bring it all together My question to you at this point is that how will we be able to get these data to those who can actually graft policies now to be able to affect the quality of the lives of those that have answered this data, from the governor's office all the way down to mayors and council? How are you working with this group of people to be able to funnel this information to them? Because we're looking at budget coming up right now. We already into budget. So how can we do that at this point?
Wow. First of all, thank you. Really appreciate that comment. Yeah, whole person care is something that we're really trying to move into. And I would say, I mean, one of the action steps, I'm so grateful for the invitation to come present to you all, because you work across different sectors. And I think even just that idea of, if as a result, you know how to download the 3-pager from your city and town and can have that accessible to share when you go into budget meetings or committee meetings, that is huge. We do have a public health liaison for each of the 5 regions, and a lot of their work is communicating these results back out to cities and towns and councils. And then through our coalitions, we have that happening kind of in the healthcare space. But I would say, honestly, like I would love to kind of hear from you all in the future if you did end up using some of the resources that we talked about today. If there's ideas for, we need no 3 pages, we need 1 page, those kind of ways, because I know that you all can also, we want to equip folks to be ambassadors of the data as well. So those are a couple ideas. And again, we'd always love feedback about ways to make it even more digestible, because you all are more experts in that jurisdictional side of things.
All right, great. Thank you, Councilmember Elvis, for that awesome question. And thank you again, Annie, for participating with us today. So we will go ahead and move on to item number 6, which is the Social Blocks Grant Funding Allocations Recommendations. And this item is on the agenda for information, discussion, and input, and will be presented by Melanie Dykstra of Gilbert, the Vice Chair of the Human Services Technical Committee. So Melanie, it's to you.
All right, thank you. Can everybody hear me?
Yep. Yes, Cam.
Okay, great. As you mentioned, we are just looking at the Social Services Block Grant Funding Allocation. We are bringing a recommendation to you from the prior committee. This is the timeline that we've been following. And if you go to the next slide, I believe it shows that we are here right now in this October-December timeframe where we're in the middle of conducting the process. So once you take some action today, then it'll move forward to the next groups to continue to proceed through the process so that they can utilize the funding and look for those that will be applying for these funds. Next slide. So again, we started this process in September. We looked for some additional data from DES. We have already met twice. We had a work group committee that met, that brought, kind of analyzed the information, the data, and then developed our draft recommendations. We did bring those forward in November to our big committee group, and we did bring forward to that group a recommendation A or B for discussion. And now we're bringing our final recommendation to you today, again, in order to move forward to the next step of the management committee. Next slide. So as you can see, in 2025, the allocation was about $3.6 million. We were working with level funding, so there wasn't additional funds to be distributed across these areas, which again are the adults, families, and children, developmental disabilities, the elderly, and persons with disabilities. So the two things that we looked at is option A actually kept all the level funding into the same target group areas. One of the work group committee suggestions, though, was to have our option to move money out of persons with disabilities, reduce the funding in that area, and move it to adults, families, and children's, which would have been option B. So that is what, and I'll give some rationale in the next slides as to what we were looking at, but those were the options that we brought forward to our full committee. Next slide. So what we were looking at is the persons with disabilities target group. We were looking to delete the $7,500 in funding for rehab instruction services, as well as deleting the line item of $40,000 in funding for supported employment. The reason we were looking to reduce funding for those line items was the fact that they really just hadn't been fully expended in the last 2 fiscal years. And we felt that then moving it to a different line item would help in utilizing the funding to its and maximize its use in the community. So next slide. So again, when we looked at option A, that $47,500 stays within the category of persons with disabilities, but we are recommending that the funding actually gets split and moves into different line items, one being adult daycare, adult day healthcare, as well as the other one would be going to home care. We have heard that there is a high need within the persons with disabilities group into these home healthcare areas, is again to try to keep people in their homes, but provide more of that home care and options. And we felt that the funding could be utilized more effectively moving to these line items. So the funding stays within the same target group, but just helps meet a need for additional respite services. And this is what we're bringing forward to you today, is our work group did agree that we preferred option A as the final funding recommendation. Next slide. But just to let you know why we didn't choose option B, what we were looking at in moving that $47,000 to housing support services, as all of you have heard and are well aware, there is a need for support around affordable housing and things. But in our discussion, we just didn't feel like this was going to make enough of an impact and a change in that service area. It did already have, it's got a fair amount of funding. So the $47,000 really wasn't going to make the impact we were looking for. So we felt as a group, it would be best to leave it within the persons with disabilities, but just move it within those line items. So next slide. So again, we're bringing forward to our recommendation A for approval of the SSBG block grant allocations so that I can move forward to the next step. With that, I can take any questions.
Thank you so much, Melanie, and thank you for all the hard work that your group does in this area. We really appreciate it. Do any members of our committee have any questions or comments? Do we have any hands raised? I don't see any questions or comments. Okay. Staff, have we received any online written comments from the consent agenda?
Madam Chair, we have not.
Okay. So with no questions and no comments on this, is there a motion to approve the recommendation A?
I'll move.
I second.
Dorsey.
Did you get Dorsey in it? Okay. All right. So we have a motion and a second. We will have all those participating in the meeting now take part in the voice vote by turning on their cameras and unmuting their audio. We need to see faces of everyone to participate in the voice vote. For those who cannot or do not want to turn on their cameras, staff will conduct a roll call vote. Staff will only call on those virtual participants who did not turn on their camera. Members, please leave your cameras on until after the roll call vote so that the staff can count the people's names whose cameras are on. Can I have a voice vote? All those in favor say aye.
Aye.
All those opposed say nay. All right, the motion carries. Members, please we don't need to leave our cameras on. We got the voice vote. Okay, thank you so much, members. We appreciate it. Now we will go ahead and proceed to item number 7, which is the Regional Human Services Assessment and Strategic Planning. This item is on the agenda for information, discussion, and input, and will be presented by Amy St. Peter. We appreciate it, Amy. It's all yours.
Great. Thank you very much, Madam Chair, members of the committee. If we can go to the next slide, please. So as a reminder, we have been conducting this assessment because we want to ensure that we're meeting the needs and priorities of our member agencies as it relates to regional human services planning. We've been operating our human services division now for almost 50 years. So that's a long time. A lot has changed, a lot in the region, a lot in your communities, a lot just even in terms of human services delivery. And so we think it's really important then to take a look at where are we putting our efforts? Are we meeting your needs? And if not, then let's change so that we are. And so then the 3 goals of this assessment, really the first and foremost is to align those activities. If we're doing something that's not providing value, then frankly, we shouldn't be doing it. And so it's been really important to hear from you what your priorities are and what you see MAG's best role as being. All of that will help us to articulate a renewed mission. What is our North Star for the division? What is our North Star in terms of human services planning here at MAG? And then to make sure that we have the appropriate staffing and committee structure. And so we have a great team here at MAG. We're eager to support you. We want to make sure that we're putting our time in the right places and that we're using your time in the best way as well. And that pertains to the committee structure. Do want to note that we have 4 different tracks of activity with this. One is a continuum of care. We're holding them kind of separate from this because they have a very clear mandate from HUD, from the Department of Housing and Urban Development, and they are conducting their own planning. We're integrating, we're informing, but they are driving their own process. That leaves 3 different other committees at MAG. That is our Domestic Violence Council, this committee, and then our Human Services Technical Committee. With all 3 of those, we're really looking at how can we help to energize the committees? How can we work with you to identify what is that strategic vision for your work? And then looking at the committee structure, and that it may or may not stay the same. And we really look forward to your input on that. If you can go to the next slide, please. The process then that we've been undertaking since August, we have been conducting a listening tour. We've talked with more than 24 different communities and stakeholders right now. That's mostly local governments as well as a handful of community partners such as local foundations. We're hearing a lot and we're learning a lot through that process. We have completed 2 different surveys. One was with you, and we have the results from that we'll be sharing. And that was with our human services committees and stakeholders, as well as the management committee here at MAG. We wanted to hear from the leadership from our local and tribal governments to understand kind of the policy perspective, and then wanting to hear from you as well to offer more of that technical perspective, kind of more boots on the ground. The data collection then will conclude at the end of this month, at the end of December. We're starting to analyze the data. We'll really dig deeply into the data in the next few months, be able to identify some trends and some potential gaps, and then be able to circle back really primarily with this committee, with you, with your joint retreat that you have scheduled for March, with the Human Services Technical Committee, and then we'll go through Management Committee and Regional Council in April. Next slide, please. So we have completed or scheduled 33 different interviews. There are just a handful more to be scheduled. Just had one this week. We have one scheduled for next week. So we're starting to wind down in terms of the interviews, but if there's someone that we haven't talked to yet that you'd want to recommend, please let us know. Happy to meet with you. Next slide, please. And this is what we've been hearing. There are a lot of issues that are really important, but housing and homelessness continue to be first and foremost. We hear about that in just every single interview and from every single community. We are cognizant too that communities are entering this conversation from different places. Some have very robust human services programs. There's a lot of staffing. There's a lot of activity. Others, when we ask what is the priority of your human services department, they don't have a human services department. And so then we need to reframe it in terms of how are you meeting the needs of your residents and how can we help you do that? And so communities are have very different levels of capacity in this space, and they're framing the work differently. And our regional coordination efforts need to respect and honor all of those different approaches, and then bring it up to a regional level in a consistent way so that it's coordinated. We keep on hearing, we had taken our questions around human services transportation out of the survey because our human services transportation team just moved out of human services and into transportation. But transportation has such a strong tie to human services. There's a lot that we're trying to do in human services that's impacted by the availability or lack of availability and access to transportation. So those two are very much linked, even though they don't come up in the survey results because it wasn't included in the survey. We are appreciative of hearing where we're valued, and MAG's role in data and collaboration continues to be recognized in each of the interviews, and we're thankful for that. We do also want to hear about things that we should not be doing or maybe be doing things differently, and we're hearing a bit of that as well, which is great. A new area for MAG, if we are approved to move into the space, would be in shared procurement. We're looking at how do we provide value to you in some really concrete ways. And one possible way would be for MAG to be able to staff cooperative procurements that reduces your administrative burden and can provide some additional values in terms of making the data, the cost information more consistent throughout the region. There's 3 different possible steps. The first would be to identify just who has those cooperative agreements already in place that could be leveraged by additional communities. The second stage could be working with you to develop an inventory of the goods, products, and services that you're wanting to procure in the next few years, and then developing a regional request for proposals in order to procure those services with cooperative language, so you don't have to run your own solicitations, all the way up to having regional pooled funding and one regional contract for a particular kind of services or range of services. Think about outreach services, case management, things like that. And none of that would be mandated. It would only be if people want to do it and want to be involved. But across the board, though, the biggest thing that we're hearing is a strong appetite for taking action. People appreciate the information, they value the data, but they want to do something with that. And so we're being really particularly mindful of that point. Next slide, please. So these are the respondents. The demographics of people who have responded so far to our 2 surveys. Human Services, 64 responses. That's a good snapshot. A lot more people received the survey. So just keep in mind that we're only able to represent the people's choices of who indicated to the survey. Management Committee, 38 responses, which is fewer, but it's the majority of the respondents that are the majority of the people that we'd reached out to. It represents 90% of our member agencies and well over 95%, 96% of the region's population. So we feel as though the Management Committee responses are more reflective of the leadership from throughout the region. And we're very thankful to the Human Services responses for giving us that snapshot. Yes.
I just have a question. Are tribal communities reflected in this?
They are. We heard from 1 out of 3. We did have additional outreach to the Native Nations, and we're thankful for the 1 response, but
Okay.
hoping to have more in the future.
Okay, thank you.
Thank you. Next slide, please. So the Human Services Committees, it's particularly important to keep this in mind as we look at the survey results for the Human Services survey. More than a third actually don't serve on a committee. They are a stakeholder and they're an important part of our process, but they're not actually formally serving on a committee right now. Roughly a third are from the continuum of care. That's important to keep in mind as well. A quarter from our Human Services Technical Committee, and so that was a great showing. 14% from our Regional Domestic Violence Council, and the 9% from this committee. So we want to thank you for your responses there. Next slide, please. So in terms of the responses then, what you see in blue are the responses from our Human Services committees and stakeholders, and the green are the responses from our Management Committee. It's interesting to note where those 2 are aligned because they aren't always necessarily, and it's interesting sometimes to look at the differences there too. But funding, number 1 concern across the board, whether you come from the human services world or city manager, funding is a top issue. We ask people, what is your top priority to address human services? What do you need to address human services? And it is funding solidly. Second, although distant second would be data, and then further down from there, community support from the perspective of the human services stakeholders, partnerships, and political support, interestingly, from our city managers who are maybe more sensitized to both of those areas. Next slide, please. Homelessness, domestic violence, and housing. So we asked people, what is your number 1 priority when it comes to human services? And this is what we heard. Interesting that for Management Committee, much higher in terms of homelessness. Human services, housing, it can be interesting to wonder if for somebody, for example, working in homelessness, if they understand that their success really hinges on the ability of their clients to find housing. And so housing rises to the top more so there. And then domestic violence, we had a strong showing from our Domestic Violence Council, although not all of them cited domestic violence as their top priority, which is interesting. I think this is really important to consider too, to really work down at removing the silos, because when you have somebody who is a domestic violence stakeholder and they're not citing domestic violence as their top priority, it shows the importance, for example, of housing, to be able to that other topics are important. And I think this is a cue to make our work more holistic and less siloed, because people don't live or operate within silos, and our response to these issues should not be siloed either. Next slide, please. Then we asked people, what are your top 3 concerns? And that's where mental health really shoots up. So it wasn't necessarily anyone's top priority, but it's a lot of people's top 3. And we just heard from mental health in the last presentation, and at these committee meetings, we've talked about the importance of mental health as well. Yes, sir.
Yeah, this is Carlos Galindo Elvira with the City of Phoenix, but you can see the links
Oh, yes.
between the issues.
Yes.
Whether it's the previous slide or this slide,
Mhm.
I mean, they're
Mhm.
all linked together.
Yes.
And if you're going to work on one, you have to work on the other two as well.
Absolutely. Very well stated. Yes, completely agree. And I've been kind of urging our team, coaching our team internally to cross-fertilize more because issues don't stay in very specific lanes and we need to be working across lanes as well. So yes, completely agree. Next slide, please. So we asked people, what are the range of human services opportunities that you're pursuing, either as a human services stakeholder or as a local and tribal government? One thing that I'd like to point out about this is how low research is, which is natural, right? You don't see a lot of nonprofits necessarily engage in research. Some local and tribal governments are, but it's not necessarily first and foremost in their portfolio of work. If we can go to the next slide, though, that's exactly where they want MAG to be. So MAG is valued for data. And so best practice information, the research, all rank very, very high. And so I think it's important to keep that in mind because we don't want to duplicate what others are already doing. We want to be able to serve the best that we can in our role. I think this makes a strong case for MAG's role to be in research and data. Absolutely. And it doesn't mean that we aren't going to do the things that will rank lower, but just we need to be putting our energies where you most need us to be. Next slide, please. We asked people in an open-ended answer, when has MAG been most effective in this work? And this is what we're hearing a lot around homelessness, housing, of course, convening, being able to provide assistance. This just gives kind of an idea in terms of when people value MAG working in this space. Next slide, please. Oh, sorry. Yep, there we go. So with a bit of trepidation, we say, hey, how well are we doing? And this is what we heard. So you see the human services responses on the left, the management committee on the right. For both effective or very effective ranks, that's the majority of the responses. I do want to point out, though, that what concerns me about this slide, frankly, is a neutral. Because sometimes I don't know, is neutral that they don't have an opinion, or is neutral that they aren't informed, or is neutral probably more likely that they're being nice and they don't want to say, we don't like what you're doing. Yes, absolutely. They're being polite, they're being nice. So this is a good baseline. I hope that after this restructuring that we can increase the people who are reporting and honestly feeling like we're doing a good job. And that will mean reducing particularly that neutral category. We appreciate people being polite, but this isn't necessarily the time for politeness. It's a time for candor. And we need candid responses to know how we're moving forward. So this is so I accept this as a challenge. I accept this as a challenge to be able to reduce the number of people who are neutral, increase the people who think we're doing effective work, because that's what we're doing, as opposed to people being polite. Next slide, please. So just some questions to kind of salt the conversation, but really look forward to any questions or feedback that you might have. Really curious to see what your takeaways are from this data. We've been looking at it, and it always helps to get a fresh set of eyes looking at it. Love to hear what role you would like to play, either hands-on or by directing our work. And then if there's anything from this that helps to inform what you'd like to do at the March 18th event. Thank you.
I appreciate that. Amy, I love the idea of the restructuring. I think that's a great thing. And again, I think you said it is talking about silos, that we shouldn't be working in silos because domestic violence has got to be crossing over to mental health. Those things do work together. So I really like the idea of looking at restructuring this committee. Do we have any questions or comments from our committee members?
There are no hands raised right now.
Nobody has any comments or questions? Okay. So I appreciate the idea of doing this. And I think, being able to also then do, if the restructuring is looking at including more possible community organizations and tribal members as a part of the committee. I really like that a lot, and I will do what I can to help with that also. So thank you so much,
Thank
Amy,
you.
for that presentation. So we're going to move on to agenda item number 8. It's update on the Pathways Home, the Regional Homeless Action Plan for local and tribal governments. 3 years ago, the MAG Regional Council unanimously approved Pathways Home, the regional action plan to address homelessness. Since that time, a number of activities have been underway to implement the plan. Brian Gruters is here. The Regional Homelessness Program Manager joins Amy to provide an update on progress made.
Thank you, Madam Chair and committee. Was just going to take a few minutes to update everybody on the status of the 2025 point in time count. Everybody is most likely familiar with the point in time count, but just a real quick recap. We go out and count folks as a region who are living on the street, in cars, in parks, and so forth. Simultaneously, we do a count of people who are living in shelters. And then, and you can see sort of the delineation there in the graph on the right, which will show you in orange, people living unsheltered, so outside, and people living, blue is folks living sheltered, so indoors. We do all of this year over year, and you can see kind of the progression through the years below, mainly because HUD asked us to do it, and we rely on some HUD funding to do a lot of the programming we do as a region. That we bring in about $46 million every year from the federal government for housing and services. And we get a lot out of it, obviously. And then in addition to that, it allows us to track trends over time. So, you know, as you can see in that chart, we were able to get a baseline every year, and we really consider this a baseline, a minimum count, if you will, because we know that we don't count every single person every time we go out. But you know, we're able to track over time. This is sort of the status of the field, if you will. You know, we use that in sort of our calculations on what we do day to day in our work. This is one data point. We have lots of other ones that we also use. But this is one that, you know, we think is important. So this year we're going to go out on the 28th of January, 6 a.m. as usual. Bright and early, be there, be square. We hope that anybody who is interested in this topic will come out. It's honestly eye-opening. It's always cold. It's always dark. And we get a lot out of it as a team. And then everybody we go out with has, you know, gives us good feedback about how interesting the experience is. We always want to kind of thank you and the folks who work in your jurisdictions for the help that they put into standing this effort up. We rely on local coordinators in the various jurisdictions to mount this effort. So volunteers and staff, I don't coordinate all of them. I work with the folks who work in your jurisdictions to do that. And so thanks to all of them. One last thing, we have a few updates coming this year. Small stuff, but things that we hope will make the count better. We're improving the tool that we use. It's a mobile app. And I will say, having done this in various communities, it's cutting edge. We work with ArcGIS software. We have a team in-house, as you all know, that does GIS. This year we're adding a Spanish version of the survey. We're also making it a little bit more user-friendly to get in and out of the app. So we have to lock it. And if you lose your password, that's challenging if you're out doing the count. So we're improving that functionality. But other than that, no major changes. We just hope to improve the experience a little bit this year and get a good count. Thanks very much.
Thanks, Brian. Great job.
I have a question.
Yes.
Do those numbers, the numbers going down to 24 have any reflective, if you look back and reflect the weather? I mean, I know that I've been doing our morning homeless count in Tempe for years, and we had rain this year and our numbers were down. And do you take that into consideration when we're tabulating this?
You know, I forget the saying, don't predict the weather, basically. I will say the numbers overall went down. What we like to focus in on, and we spent a lot of time ruminating on this. The important thing here is that more people went into shelter. So you see that blue patch gets bigger, and that's relevant just because we couldn't have done that without shelter beds. So I think probably the most likely scenario is that we had more shelter beds and a weather event that really encouraged people to use those beds. If it had rained and we didn't have shelter beds, you know, that number wouldn't have gone up. So I think all of that points to we're doing good work.
I appreciate that. No, I love it. One other thought is that in Tempe, we started doing 3 years of spirit, started doing a summer point in time count. And it has been really helpful for us to understand where the population of our unsheltered are in the summer. Has that ever been a consideration? I know that's not mandated by HUD, but has that ever been a consideration for what we do here?
I would say everything's a consideration. been extremely impressed by what Tempe's been able to do. I think it's highly encouraged that communities do everything that they can to better understand their population. Now, with that said, the kind of wide net census approach is generally not the best way to get an accurate count across a region, and we rely on the homeless management information system data that we use for that. For what it's worth, I just saw a report that came out of Minnesota. They did a statewide count where this is fascinating. They went into depth in their questionnaire. So they asked, have you been homeless one night or 1 to 14 or 15 plus? And then they broke down every indicator by how long you've been homeless. So the upshot of all of that, folks who were homeless longer tended to have predictably longer instances of incarceration, more mental health issues, more drug use issues. And they were able to definitively say through data, look, your outcomes are worse in terms of living on the street for longer periods of time if you have these other issues. And that's a thing you could do with a count. But so look, all of that stuff is kind of on the table. Mostly it's a resource question. But yeah, thanks for the idea.
That's great information. Thank you so very much. Do we have any questions from our committee members or comments? No. All right.
We have
We'll
a
go-
few more slides.
Oh, sorry.
Sorry. I will make this brief because I know we're coming up to the end of our time together. Just want to provide a quick update on Pathways Home. We have those 3 goals, and today's update will really focus in on Home is Where It All Starts. That's a public education campaign that was developed because of Pathways Home, because we found the need to increase acceptance of housing that's affordable throughout the region. And unfortunately, the term affordable housing and other terms like that can stop more conversations than it starts. So we identified the need for this campaign in the plan, and it supports working together regionally as well as increasing housing options. Next slide, please. Just by way of background, we launched a campaign earlier this year after almost a year of working very closely with your public information officers, with you, with other stakeholders. The primary driver for the campaign truly is that website. We have the website, we have a toolkit right there, and a lot of what we're doing is to drive people to the website so they can access the toolkit. Very thankful to our partners. We've been partnering very closely with Home Matters to Arizona throughout the development of the campaign and throughout the launch. And also they brought in Cox Communications. We have an integrated partnership with them, and I'll be talking a little bit more, but that's been incredibly beneficial to help us stretch our dollars. And then very thankful to our sponsors who provided funding for those regional media buys. Next slide, please. The campaign goals, though, then it's really about changing the conversation around housing. It's about giving people tools so they can have more constructive conversations, no matter where they are along the political spectrum or any other spectrum. If we can't talk about it, we can't fix it. And so this is about having those conversations. And to do that, we're cultivating champions, coalitions of support. But it's really about increasing the housing options because people are just more in support of it. Next slide, please. We've worked very closely with Cox Communications and with our partners, Home Matters to Arizona, to be able to identify who exactly are we trying to reach, because we can't reach everybody. We need a message that's very tailored. And how are we going to measure our performance? And we've been able to do that. And then we have some data that we can share with you. But overall, we've reached a lot of people in a variety of different mechanisms. Next slide, please. And it's award winning. Super excited about that. It's a local Emmy, but it's an Emmy. That was for our 60-second video. We have a 60-second, 30-second, and 15-second. They're all available on the website. We encourage you to check it out, to share it, to post it, to link to it. I'm really just wanting to get the word out. Next slide, please. And then these are some of the metrics that Cox has been reporting. This is a time frame from April through last month. And the campaign itself will continue through the end of this month, and a little bit more to come about that. But we've been reaching a lot of people. We've been doing so through a variety of different platforms because we need to meet people where they are. And so we understand that different platforms will appeal to different generations, and we want to reach people of all ages through this within that target audience. Next slide, please. The next steps then, our money for the regional media buys, we're just about through it. We have a little bit of funding left. We're looking at how to best use that bit of funding that is remaining. We are working with ASU's Morrison Institute. They just launched a survey last month that is community-wide, it's region-wide, to get a baseline of people's perception of housing and who needs housing that's affordable. So really eager for the results of that survey. Thankful to them for undertaking that on behalf of the campaign. We'll continue to analyze that and other metrics and then look at what kind of fundraising might be needed. Home Matters to Arizona has basic staffing that's been committed long-term for this, which is fantastic. But if we want to do more media buys or anything like that would require more funding. So if we're going to need more funding, we'll have to do some fundraising around that. But look forward to any input that you might have and direction you might have about the campaign. Next slide, please. And there we go. If we can go back one, please. That concludes my presentation. Any questions or comments?
Do we have any questions or comments from the committee? None?
No
All
hands
right.
raised.
Thank you so much for the update. Appreciate that. And I am going to get on and share that video though. Thank you very much.
you.
So we're going to move to item number 10, which is the comments from the committee. Are there any comments or announcements from our membership?
No hands. Oh, Councilmember Klein.
Councilmember Klein.
Thank you very much. I have truly enjoyed being part of this committee over the last few years and wanted to say thank you to everyone who supported my comments and my involvement. This will be my last meeting as my term expires at the end of this month. So I'm wishing you all a Merry Christmas, Happy New Year, Happy Kwanzaa, anything else you happen to celebrate. And I don't know who our new incoming mayor will select for this group, but I'm sure that Seth Dyson, being our HSCV coordinator and director, will have someone on the line for you. So reach out to him in the interim, and happy everything to everyone. So thank you very much.
Thank you so much for your dedication to the committee and all that you've offered. So thank you so much. Do we have any others? No? I just don't want to say as we wrap up, is that we are looking at having a meeting in January for this committee. We don't have the date yet, but we will get back to you on that. And the council member, Galindo, Elvira, and I are really lonely. And as you can probably see in the video, we would love to have more friends join us. And to entice you all a little bit, I will bring really awesome sweet treats next time. So if I can get you by food or by fun, I would really, really like it if you guys could join us in person and sit around the table with us. It's great to get to know each other a little bit better. And I think that's easier to do when we are sitting here together. So I just would encourage you best that you can make it, and let's do the good work, but let's have fun while we're doing it and getting to know each other better so we can work harder together for the people in our communities.
Madam Chair, if I may say, no sweets, please, but you can get me with a good lunch and a great salad.
Hey, if you're coming, girlfriend, I'm getting it for you. All right, now we switch to an early lunch. We'll call it a brunch.
That's right. Let's do that.
All right. I just want to say thank you for our committee for being here. Thank you so much for the guests and the speakers that we've had. It's meant a lot, and there's really some really great information here. And we just want to say thank you so much to everybody. And if there's no further business for today, then we will adjourn our meeting right now. So thank you so much, everybody.
Thank you.